Hello, and welcome to a special edition of Up Close on METV. I'm Charles Clapsaddle, station manager for Manatee Educational Television. And on this very special edition of Up Close on METV, we're very privileged to have with us two co-authors of the book, The New Health Age. And let me start by reading a quote from The New Health Age. The New Health Age offers a succinct primer on how we got here and where we should be taking the health of our nation. And that's from Dr. Oz, who is now recognized as one of the great health people on television. And joining us today, we're very pleased to have with us Jonathan Fleece. Jonathan, thank you so much.
Good to see you, Charles.
And futurist David Houle. David, thank you for joining us today.
My pleasure.
Well, gentlemen, what is the New Health Age?
Well, as a futurist, I'm excited about it. It is the new age of health globally and particularly in the United States of America. It is a time when we're moving to the next stage of modern medicine. It's a time for wellness. It's a time for transformation of the healthcare system. It is a great time to be alive if you're interested in health, wellness, and longevity.
And David, you've written another book as well, which
Right.
is, it kind of ties into, and tell us about that book, which has gotten a great reception. It's called The Shift Age.
The Shift Age, yeah. Well, the Shift Age is the age that we've moved into. We've left the information age and we've moved into the Shift Age. And the New Health Age is kind of an extension of the Shift Age. Modern medicine began back in the early stages of the Industrial Age, took us through the Information Age. Now we're in the Shift Age. And in this 21st century, the Shift Age is moving us into this century, and I think this century is going to be thought of as the new age of health.
Well, Jonathan, the question then arises, what is the state of our health? What is the state of America's health that you've put together in this book?
Yes, if you look at where we are as a country right now, we're not in great shape with respect to our health. Nearly 1/3 of all Americans are considered clinically obese. Nearly 2/3 are considered overweight. Only about 25% of Americans regularly exercise and engage in physical activity. If you add up the total number of Americans that die each year from preventable diseases that are strictly associated with their own choices, it's about 1.5, 1.6 million Americans. Almost the entire population of the city of Philadelphia die each year from diseases that they could prevent based on their own lifestyle choices. So we're not very healthy right now.
And that is a case across the country. There's epidemics of childhood obesity, there's smoking and non-exercise, all of the cases that you meant. So where do we go from here? What's the next steps that you would see? David?
Well, there was a law passed in this country which basically set a new direction. And regardless as to what happens with that law, the change has already occurred. Healthcare is going to become patient-centric and primary caregiver-centric. No longer will everything be disconnected. It will be much more cohesive. In fact, there's a chapter in the book called the 80-20 chapter.
And that's probably one of the chapters that a lot of people are going to be interested in. Explain what that means.
Well, it's kind of the chapter I use in the cocktail conversation when I'm trying to describe healthcare. Health and the transformation of it. Healthcare is about 17.2% of the Americans' GDP. So rounded up to 20%. So basically, in the new health age and in the new landscape of healthcare, all of that wonderful stuff that's in the 80% of our GDP, connectivity, searchability, transfer of electronic data, all of that is just coming to healthcare. So all the wonderful stuff, all the devices we have, all the demands we have about being able to search things, all of that is coming to healthcare. So it's simply that healthcare, 20% of our GDP, is now going to get upgraded to where the 80% already is.
And a perfect example of that would be, let's look at your financial records. In today's banking system, you can be in the great state of Florida, travel to California for vacation, and if you're a banking client of a national bank, or even if you're not, you can put your ATM card into a machine, access your money, go into a bank teller's office or a branch office, access your financial information. But in today's healthcare delivery system, you can literally sometimes be across the street from one provider to another provider and not be able to easily access some of the most important information in our lives, and that's our health information. And it causes not only inefficiencies, as David just mentioned, but certainly clinical quality issues in our system today, not having that connectivity.
Well, everybody says that America has the best health care and the best doctors and the best nurses and the best facilities, but technology is really kind of catching up and continues to catch up with some of the medical care that's being provided. But I want to move on for a moment, if I could, to talk about some of those technology things. Now, you used a perfect example the other day when we heard the two of you speak at the University of South Florida, and you were talking about some of those new companies that are doing new and innovative material. Can you relate one of those stories to us?
Jonathan, why don't you?
Sure. No, it's a great story. We talk about new dynamic flows of change that are occurring in the new health age in our book. One of those flows is that we're moving from an era of being reactionary to prevention, and from treatment to prevention, and from being reactive in the past to being very proactive in the future. Great example of that is a company that is manufacturing a new way of creating curtains and privacy systems in emergency rooms. Today, Americans, when you experience an ER situation, you go into the emergency room, and we all have seen those curtains that get sort of opened up around us to maintain that privacy. It's generally made out of fabric. Well, if you think about bacteria can get caught up and reside within those fabrics. That bacteria can unfortunately be transferred to patients, wounds, things like that, and that can increase the chances of infection. Well, as our system moves to an environment where healthcare delivery providers are going to be paid based on keeping infection rates down and motivated through the dollar to keep infection rates down, they're looking at technologies that will decrease those infection rates across healthcare. This company's come up with a device that works a lot like the paper towel dispenser in public restroom. Patient comes in, sees the physician, the nurses, has their episodic treatment, leaves, rip down the curtain, new technology comes in, it will bring down a new, completely clean, bacteria-free curtain to be used for the next patient. Just an example of some of the technology that's going to be out there coming in the future.
But one of the things, and I believe that, and I'd like to ask both of you, is that those positive steps result in hospitals and healthcare providers being more accountable. Where it's basically, and I think you used the example of being able to say, if you're going to look at the facts and figures on one hospital where an infection rate or is higher, you can have that data at your fingertips to make informed decisions, which I thought was a wonderful aspect of it, because that's not available at this time. Is that correct?
That's exactly right. The connectivity and the accountability are two of the key things for the new health age. In other words, if you have a loved one who's sick, say perhaps has cancer, you want to be able to search and find out the people in your area that have the highest degree of success in treating that cancer. Or if you have to go in for a hospital stay, what if one hospital has a 10% infection rate and another has 5%? You're going to know that. You don't know that now. And that goes back to that 80-20 thing. Knowledge is so important, and we as consumers and we as patients, nothing is more important than our health.
Exactly.
So here we are where the most important thing, our health, we have the least information about. And to the connectivity, think of it as you will own, Charles, your medical record, and you take it with you. You own it. You don't have to ask permission from some doctor over here to ask them to fax it to somebody else. You take it with you. You are in charge of your own health.
And that makes a positive step in the right direction. Now, Jonathan, in the book, you've described, or even mentioned just briefly, some of these dynamic flows that are part and instrumental in the new health age. Tell us a little bit more about what those dynamic flows are and what they mean to the future of healthcare.
Yes, the 9 dynamic flows that David and I have come up with to describe the future of healthcare in America really center around 3 core areas. One, how we think about healthcare is going to change, how we deliver healthcare is going to change, and the economics around healthcare are going to change. And really, when you go back to one of your first questions, Charles, what is the new health age? We spent over a year researching this topic and really wanted to try to drill down and take a lot of the noise out of the debate and the discussion that's occurring in America today about healthcare.
Right.
Drill it down into some very succinct, understandable concepts that people could relate to, and that's what these 9 dynamic flows are about. So just to give you a few quick examples,
Sure.
One under the thinking flow. When Americans think of healthcare today, so many of us think of healthcare as where we go when we are sick or when we are injured. And it's not that in the 21st century sickness and injuries will go away, but we're going to think about healthcare in a much more broad sense of the word and much more inclusive, and include wellness, prevention, and the concept of a holistic system. Where we look at healthcare as where we go to prevent illness and to stay well versus just being reactive.
Reactionary.
Exactly, reactionary. On the delivery side, another flow that's major for the future and is occurring today is integration. Today, healthcare to a large degree functions in silos. Perfect example of that is, let's say, hip surgery. Patient falls, breaks their hip, taken to the emergency room, diagnosed broken hip, transferred to the OR, surgery's done, transferred to the floor, maybe discharged at that point in a few days, goes to rehab, goes to physical therapy. All of those episodes and episodic treatments are very siloed. Healthcare is going to become a lot more integrated moving forward in the sense that you're going to have more parties coming together, coordinating the care through technology, through joint ventures, through agreements, and through the payment system. So a lot more integration. Then speaking of economics, we're moving into a performance-based model under healthcare. I mean, as David said under the 80-20 section, think of all of the areas of America and in our economy where people get paid for their performance.
Exactly.
You know, the top performers get paid more than the low performers. All of that economic incentive program is coming to healthcare. Those that produce the best results, the highest quality, the low infection rates are going to get paid more than those that don't. It's going to be an economically driven and motivated system.
If I could jump in there, Charles. You know, one of the reasons we wrote this book is the current conversation about healthcare reform is driven by misinformation, fear, and manipulated by politicians. And so sometimes it's easy, the way to think about it is just to think about it very easily. Like Jonathan just mentioned, integration. So think about how you buy an airline ticket. Now, you just pay once, right? You don't have the ticket agent charging you, the baggage handler charging you, the flight attendant charging you, the captain charging you at all. I mean, it's all integrated, and yet in healthcare, you get an invoice from each one of those. Just in that hip surgery situation that Jonathan mentioned, there are about 3 different invoices you would get that you would have to figure out, and you don't know whether it's valid or not, and you can't comparison shop. So just think about the way you buy an airline ticket. That's the way you're going to be able to look at healthcare, and it's going to be integrated.
And imagine the cost savings that
Exactly.
what David and I just described will bring to America. We haven't talked a lot about that, but that's at really the sort of the core of the 20th century model, and what we're having to move away from in the new health age is controlling the cost of healthcare.
And effectiveness of the cost too. I mean, if there's a genuine cost there, you don't mind paying it, but you want it to be effective use of your dollars.
Exactly.
And there isn't anybody listening to this program that didn't at some time in their childhood hear an ounce of prevention is worth a pound of cure. And right now we have a medical system that's paying the pound of cure rather than the ounce of prevention. There is no way a doctor under the current healthcare system gets paid for keeping the patient well. They only get paid for treating sickness.
But David, I want you to put your
Sure.
futurist
Sure.
hat on for a minute, because some of the things that Jonathan just mentioned, they seem so logical and they seem like, a natural progression. But what about the transitions? I mean, are transitions from a present system to new methodologies, are those going to be difficult? And what kind of resistance can you see in the future?
Well, as a futurist, I look at movements and transitions. Transitions are always difficult because most people can't see where they're going, so they don't know, they can't embrace something better. They're nervous that it might not be as good. And also, in any kind of transition of this magnitude, there is going to be an increase in cost before cost goes down, because there's the old system in place, the new system has startup costs, and it's only in probably the second or third year in this country that we're going to start to see healthcare costs go down, and then they're going to start to go down dramatically.
But what are some of those new structures, Jonathan? I mean, you've seen them, you've been out there, you've done the research across the country. What are some of those new structures that are developing?
One that we're really very excited about, and it's been a concept that's been around for a while, but it's finally taking life, and that's called the medical home. The concept of the medical home is that there will be a healthcare team led by physicians, as it should be, because physicians ultimately are certainly the clinical guiding profession in America. So it will be led by physicians, but it will be truly a team of healthcare professionals that create this holistic, looking at the entire life body experience in the new health age. So for instance, you'll have dietitians and nutritionists on the team to try to work with families on how to eat right, control obesity, and keep the right nutrients and balance from a nutrition standpoint. You'll have behavioral health folks on the team, because so many of our lifestyle choices that may not be the best options for us from a health perspective, they're lifestyle choices, and behavioral health folks are going to really be sort of at the forefront of helping us make better choices for our life and for our health. And stress management. Many chronic diseases have their root causes back to stress. So you'll have a lot of stress management as part of this team. And then when folks do have chronic diseases impact their lives, whether it's heart disease, COPD, meaning a pulmonary or lung problem, diabetes, then certainly specialists that focus on in those areas will be critical to be in that medical home environment. So medical home is really going to be the core model of where healthcare is moving, to look at that prevention, look at that wellness, create that holistic experience to prevent disease from occurring in the first place. That ounce of prevention will save us so much money long term.
And one of the things that we concluded after this year of research is that it's going to be the America's corporations that are going to lead the way. A lot of people may have heard of the Accountable Care Organization. We think it's going to be the Employer Accountable Care Organization. Simply put, American corporations are no longer competitive in the global economy because they have this extra healthcare line item cost that they have to pay that companies in Germany, Europe, China don't have to pay. So employers are going to take charge because they'll understand that healthier employees are more productive employees, will show up for work, absenteeism will go down, and that will lower the healthcare costs. So it's not that the government is going to lead the way. The government has just said this is the direction we're going, and corporations are going to get it done.
Well, I believe the example that you used and put that in was Boeing.
Right.
Where Boeing has a line item of healthcare.
I think it's $2.3 billion. So think of them competing to Airbus, or think of General Electric with the $3 billion, as I've been told, line item cost of healthcare, competing with Siemens or somebody like that. So it's really, you have to look at it holistically. In this global stage of human evolution, in the global economy, that's one of the influences that is impacting this change today in our country.
Well, our healthcare delivery providers, are they moving in the right direction? Do you feel that there's the impetus there for them to start developing change?
Well, let's circle back to a comment you made earlier in the program. We do have truly one of the best healthcare delivery systems in the world. We have some of the best doctors, we have some of the best hospitals, we have some of the best research and development centers, academic institutions. We have wonderful, wonderful healthcare systems in America. What the new health age is going to do is re-engineer and restructure the current system that we have to really to make it even better. So are they moving in the right direction? Transitions are very, very hard, as we talked about earlier. And as we said as well, in the 20th century model, physicians and many healthcare delivery providers, they were not paid to focus on wellness, to focus on prevention, to be proactive. That wasn't part of the economic system. That's where the economics are headed, and as the economic and then the payers start to reimburse healthcare delivery providers in the right ways, then yes, they're going to be doing a lot more of that, and we'll move through this transition. But it is hard for healthcare delivery providers now to restructure their whole model.
And we're the United States of America. We're a land of freedom and choice. So employers are going to say you're 75 pounds overweight. They have an employee that's 75 pounds overweight. Right. They're going to say they're going to do all the things that Jonathan just said. We're going to help you with your nutrition, give you a personal coach, help you lose weight, and we'll give you $1,000 at the end of a year if you do that. Well, if I don't want to do that, okay, so then we're going to charge you $150 or $200 more a month for your health care because you're a higher risk. That's what you need to know, that 70% of all health care costs in this country today are absorbed by 10% of the population. So if you can reduce that by 10%, you're reducing costs by 7%. Very simple.
I'll give you a quick example, Charles, of a new model that's coming out of the structures and the economics, just to help healthcare delivery providers see the future and the economic opportunity that they have. One is the concept of group health. You know, if you're a physician today, you have a full schedule of, let's say, 30 to 40 patients a day. You're seeing one patient at a time, getting paid in incremental units to see all those patients throughout the day.
Exactly.
Employers today, cutting edge payers, are moving to this concept of called group health, where you may literally be able to fill a room of 50 to 100 patients, bring one doctor in at the beginning of the program, have that doctor spend 30 minutes to 45 minutes or an hour talking about whatever disease or whatever topic is of the most importance at the time. Get paid for 1 hour by all 50 to 100 patients. It's group health. So it's a whole new model that physicians and some delivery providers aren't accustomed to today, but will give them economic prosperity moving forward. Another quick example of just great economic motivation for the delivery system is shared savings and paying them for making a population group healthier. You know, David mentioned the employer models. In America today, the average employee costs $12,000 a year to an employer to insure. So if you can put together this medical home model, be proactive, focus on wellness, prevention, and all the things we've talked about, payers will share some of the savings around that $12,000 with healthcare delivery providers, physicians, et cetera. Bring it down from 12 to 10. We take 1,000, we'll give you 1,000. So major, great, exciting models coming down the pike.
That's a very, very exciting idea, and I think you're going to see a lot of organizations, major corporations probably embracing that. But as we wind down, gentlemen, I want to take a few minutes because I want to get your input. Well, what's healthcare going to look like? You're a futurist, David. Jonathan, you're a top-notch attorney. What is healthcare going to look like 5 years down the road? 10 years, 20 years. What is the future of healthcare?
Well, that's where I get really excited. And I've been talking to audiences all around this country, and they get excited. I tell people, stay alive, stay healthy, because in the next 10 years, there's medical miracles. For example, genetics. Anybody listening to our voice, in about 2 years, will pay $1,000 to have your entire genetic map done. So you can anticipate, you can find out what genetically is in your body and start treating it before it happens. Think about that. Or think about the fact that you'll have complete eyeballs as good as the ones you were born with, being able to be implanted in 2 or 3 years. Our body parts will be better than the ones we were born with. So I say to people, anybody over the age of 40, stay really healthy, because in the next 10 years, there'll be medical miracles that will keep you alive. So to answer your question about 2015, 2020, 2025, I think 2015 is when this country is going to realize the new health age. And it's going to be better understood. People are going to feel healthy. Costs are going to come down. Everyone's going to get excited. By 2020, those medical miracles I just referred to will become much more commonplace. Healthcare costs will go down. And 2025, you know, and we can talk about this in a second, about this idea we have to really mobilize the United States of America to become a much healthier country. So I think 2015, we're going to notice it. 2020, we're going to be living it. And 2025 will be a transformative time.
Which brings us to our final point today, and it's something that you both of you are very instrumental in, and it's called Race to a Healthy America. And Jonathan, what is that? How can people get involved? And tell us what's happening with that.
The Race to a Healthy America is really one of the most exciting components to our book, and we announce it towards the end of the book to really give America and the readers sort of a call to action as to what can they do next to really enter into this great new era, the new health age. David and I are both Floridians. David has a condominium down here, is a professor, futurist in residence at Ringling. So we have, and futurists, we have great connections here in Florida. If you look back at one of the most exciting movements in America's history, it was the race to the moon. So we came up with the concept of let's launch the Race to a Healthy America on the east coast of Florida. And basically, in a nutshell, we want to make America the healthiest nation on earth by 2025 is what the race is all about.
And if I can just jump in, all across this country, people have asked me, are we going to remain a great country? And we have a vision deficit. The last vision we had was this race to the moon, or beating the Russians there. Yep. So, you know, I want to look into the camera and to say to all you viewers, by 2025, join us to the Race to a Healthy America to become the healthiest country in the world by any metric. It's very simple. It's a very simple action, and we can all come together rather than talking about our differences. Let's join together and become the healthiest country in the world by 2025.
We're going to invite you back in 2025 and just see how healthy
I'll be here. Right. I will be here.
Probably healthier than ever.
Right.
Gentlemen, I can't thank you enough for taking the time out of, I know, a very busy schedule for both of you and to talk about this. This is a very important book, and I would encourage people to pick up a copy of this. If you're a family member or a business person, this is an important book for you to understand. It's going to be available on Amazon.com and BarnesandNobles.com, so pick up a copy and make sure that you can understand that. Endorsed by Dr. Oz and by two gentlemen here who have really put in a lot of work and effort, and a lot of love goes into this book too. I mean, you can tell that there's just a great deal of information that's really relevant for this nation. So, gentlemen, thank you very much, and we'll hope to have you back at another time. Perhaps we can talk about that Race to a Healthy America.
Absolutely. Charles, thank you.
Thank you so much, Charles.
And thank you, gentlemen, for joining us, and thank you for joining us. Thanks, David. And thank you for joining us on this special edition of Up Close on METV.